on stage. We'll also be joined online by Brendan Kwesiga, the Technical Health Financing Officer from the World Health Organization, and we'll be sorting that bit shortly. He will be joining us online. So over to you, Dr. Rose Wangeshi. Yes, and also there is Dr. Njeri Gitau, Senior Director from the Presidential Delivery Unit.
Good morning, everyone. My name is Dr. Rose Wangeshi from the Kenya Dental Association. This morning, I'm representing my president, Dr. Tembe, who wasn't able to be with us here today due to some commitments in line of duty. It's my pleasure and a great honor to be moderating this session, the role of leadership management and governance in health, and how we can streamline regional coordination in health through governance. And I'm also the Deputy Director Medical Services in Kiambu County. And at this juncture, allow me to proceed with the session, and maybe I would kindly request that our panelists introduce ourselves, starting with from my far right. Thank you.
Good afternoon, everyone. My name is Daniel Tembe. I come from Rwanda, from the Rwanda Healthcare Federation. I am a pharmacist by profession. I am an advisor to different boards in Rwanda, but also in the region and beyond in Africa. And I'm really, really happy to be here. This is a very, very interesting topic that really talks to me. Thank you.
Thank you very much, Dr. Daniel.
Good morning. By this time, I think you probably know who I am. I'm Ian Clark from Uganda, and I've been involved in the healthcare sector for more than 30 years in private and not-for-profit, and even a bit of government involvement. And I'm currently the chairman of the East Africa Healthcare Federation. And don't forget, we're having a conference in September 28th. Okay. Expect you all there as well.
Thank you, Dr. Ian.
Good morning. My name is Dr. Francis Monizy. I work for the Ministry of Health, and I've been as a registrar for private health facilities. I've been working in health almost for 29 years. And also I work as the secretary of the private health advisory board for advising the Ministry for Health in the issues of registration, control, and the regulation of private hospitals, and the owners of those facilities include personnel and the organizations. Thank you. I'm very happy to be here.
Thank you, Dr. Monizy.
Good afternoon. I'm Dr. Mohammad Shakur. I'm an internist and gastroenterologist. I own a private hospital in Addis Ababa, and I'm vice chairman of the Ethiopian Healthcare Federation. I have worked for the last 25 years. This is my third time in Kenya. I'm very happy. I thank you.
Thank you very much.
Good afternoon. My name is Dr. Christine Zagini. I work in the Parliament of Kenya. I clerk the Health Committee of the Senate. I'm very happy to be here. Actually, this is quite different from me. Usually I'm around government circles. So thank you, KHF and the rest of the partners for your invitation. I have worked in the government, I think now for almost 12 years, first in the Ministry of Health and now in Parliament. And I'm very interested in this session. I think it should be very interesting.
Thank you, Dr. Zagini.
Thank you very much and good afternoon. I'm also happy to be here this afternoon. I was here yesterday, and yesterday we had Amanda, I was the only female. Today we are 3. We're getting better. Dr. Njeri Gitao, I'm a Senior Director at the President's Delivery Unit, overseeing the health sector, amongst other sectors. I have over 20 years experience in the health sector, working both public, private, and back to public sector. And I've worked in different capacities in Ministry of Health. I've worked at the World Bank, at AMREF, and I'm back now at the Ministry of Health. And I sit on several boards, including an advisor at Open Fences. And I'm also a focal point at a Global Fund Technical Review Panel. Thank you.
Yeah, thank you so much, Dr. Gitao. And I think we also have one panelist online. Maybe if you could you can hear me, maybe I could kindly request that you introduce yourself.
Thanks very much. I can hear you. Am I audible? Can you hear me? Are you able to hear me?
Yes, we can hear you.
Okay, thanks. So I'm Brendan Kwesiga. I work with WHO Kenya Country Office. I lead the Universal Health Coverage and Life Cost team. But I'm also a technical officer in charge of health financing in the WHO Kenya Country Office. I also have worked within the region in Uganda and a bit of Rwanda, so I'm also delighted to be among this distinguished panel and also among colleagues and friends. Thanks, and I look forward to the discussion. Over to you.
Thank you, Kwesiga. I'm glad this morning because Kiambu County is actually a beneficiary of Open Fences, and where we learn more about having public and private collaborations. And maybe if I could ask Dr. Francis Monizy, maybe you could please paint for us a picture of how the private sector in Tanzania is engaging the government. And yes, how is the private sector in Tanzania engaging the government in Tanzania?
Thank you very much, moderator. In Tanzania, actually, we have the policy which is talking about the issue of private partnership. Sorry. Thank you, moderator. In Tanzania, even the policy it is stipulated the issue of public-private partnership. And public and private, actually the private are being engaged more in the actually whatever is being transferred in the Ministry of Health. And the private sector actually contributes almost 44% of the whole health sector. So it plays a big role, and it is a complementary of service activities. And on the issue of actually, some of the board members of the private sectors are being led by AFTA, which is also being involved in everything within the ministries. Actually, the meetings that are being conducted in the ministry, and even the ministry actually is supporting some of the private facilities, especially those which are offering specialized services and those of faith-based organizations. We have, for instance, 2 hospitals at the zone level, Bugando and the KCMC, are being supported by the government in a very big deal. In instituting the cancer facilities, they are operating it. They are being supported in terms of staff are being paid by the government, and also some funds that are being provided by the government in order to reach its goal.
Okay, thank you so much.
And because in the 10 top priorities, the involvement of private sector is there, and one of the areas, I think it is the 30 priorities, is to establish medical, specialized, actually specialized and super specialized medical care, and medical tourism, where the private sector is highly involved.
Thank you so much, Dr. Monizy. Indeed, some great things happening in Tanzania, and it is often that if you want to walk fast, you walk alone. But if you want to walk far, you walk together. And it is very important to be cognizant of the fact that the private sector and the public health sector should work in synergy in order to have good health outcomes. Maybe if I cross over to Rwanda, to Danny Mutembei, the Director, Rwanda Healthcare Federation. What do you think that the private sector governance, how can the private sector governance be improved to ensure that we have better regional coordination?
Thank you very much. That's a very good question. There is so much that the private sector is doing in the health sphere, and in our federations, there's a lot that they've been doing. Maybe I'll start with the positive points. If we were able to come together, and you have a federation like the Kenya Healthcare Federation that is among the oldest in the East Africa Healthcare Federation, along with the Uganda Healthcare Federation and AFTA from Tanzania, that came. Then they pulled other federations, and we're quick to join in. But we loved the mentorship and shared of best practices. What I think that the private health sector should do better, and I think that's what is being addressed. We have to position ourselves, and that's what we're doing, positioning ourselves to the public. We should not wait for the public to tell us where the public priorities are. We actually address, and we've been doing that. An example is during COVID, when we saw how different countries were scrambling into closing borders and dealing with own issues. There was, in some countries, little involvement from the private sector. And in other countries, on the other side, there was a tremendous involvement from the private sector. But again, coming back to the question, there is making our voice heard, louder, but also not working in silos. We have strong private health organizations that are already in place. And it's not important. It's not even necessary actually to reinvent the wheel. If I took the example of Rwanda and the Rwanda Healthcare Federation, it is the private sector representative in health, and that's how it should be. Same thing with other federations, and this means that if another organization from the private sector is coming and is doing something else, it creates what you call a cacophony. The government doesn't hear clearly the sound of the private sector. So we have to come into one voice and the same umbrella, and these exist, and we have clear-cut objectives and priorities. Private sector. I would really like to apologize. I have to run, fortunately, and really disrespect from my fellow panelists and the audience. I really sincerely apologize. Yeah.
Thank you very much for your inputs, and I think we allow him to go ahead. But he left us with a very important aspect. He reminded us of COVID-19. And in 2020, we were hit by COVID-19, and it ravaged economies and even the social and economic systems. And over above that, it really adversely affected the healthcare system. But maybe Dr. Jerry Gitao, how would you describe what is one of the best practices like the Kenyan government had in terms of handling the COVID-19 pandemic?
Thank you very much, Dr. for that question. And I like to say that in as much as the COVID pandemic was a terrible catastrophe for all of us, I think for the health sector specifically, it's one of the best things that happened because it really brought together public and private sector to work together. I think for the first time, at national level, county level, in the minds of Kenyans, we all realized how important health is to the economic development, socio-economic development, and well-being of a country. And we saw private sector coming on board to provide masks, to provide sterilizers, to come together, pulling together to put money and collect food donations and medical donations, and working with the private sector, with the public sector, to in the pandemic, in the response to the pandemic. And this didn't happen out of a vacuum. Suddenly, that the government realized that private sector is here and it's important. This was a culmination of so many years of work of government engaging private sector through KEPSA, for the health sector through KHF, and because we had established platforms for engagement. It was much easier at that point in time for private sector and public sector to come together and work towards the COVID-19 response. And of course, we had over time worked on a lot of policies and regulations that have ensured that our private sector is part and parcel of national health system, but also of the other sectors of the economy.
Thank you very much. And maybe on the same note, I would love to engage Brendan Kwesiga, who is the Technical Health Financing Officer at WHO. And at WHO, I'm sure you engage both the private and the public sector. And from where you sit, what would you think is the greatest challenge in terms of coordination of health at the county and the regional level?
Thanks very much for your very good question. And I will be.
I think we can't hear you. Maybe you could unmute yourself.
Can you hear me now? Are you able to hear me?
Yes, we can hear you now. You can go ahead.
Okay, thanks very much. So I was saying I'll start by appreciating some very brilliant thoughts from colleagues who have spoken before, because I think to form a basis for my response. The colleague from both Tanzania and Rwanda talked to the issue around what to engage on and also how to engage. So the content of the engagement. So to me, those are critical pillars, and I think even picking a bit from what I talked to on the last day I was there, there are key elements around which we engage, and that could drive the engagement both between between public and private at national and county level, but also form a basis for even stronger regional collaboration. So my outlook at this is that once we have functional governance and coordination structures in the country, then to be very easy to have this function at regional level. And I think that's also something Dr. Njeri talked to, the role of having these structures very strong at country level. Now, how that can happen to me is through strengthening the governance structures, and the governance structures is around the role of government in driving this discussion. So it's not supposed to be a goodwill gesture that Dr. Clark or KHF sits on a table to discuss as a private sector representative. There should be good functional coordinating structures, and giving an example of Kenya, I think Dr. Njeri says because we had this in place, it was very easy for Kenya to utilize the private sector across all the pillars, all the functions of the health system, for us to be able to leverage their contributions and competencies. Now, in trying to talk to how best to engage, so we know the content on what to engage on: policy, regulation, financing, and those have been mentioned by colleagues from both Rwanda and Tanzania, but also alluded to by Njeri. I think there will be important aspects around ensuring that government and private sector own the strategies, so joint strategy setting, joint understanding of the landscape, and I know Kenya is a good example around trying to generate an understanding of the entire ecosystem, so that you're able to identify all the competencies at national and county within the ecosystem, so that you see how to leverage wherever they are in that setting. Now, having done such an ecosystem mapping, then also there needs to be actions around aligning all actors towards the ecosystem. The alignment can include both the hard actions around regulations, but also the incentives around, for instance, driving some investments in areas which private sector could be willing to invest in, but is currently very risky. So de-risking the private sector in some of the aspects, so that we work together to achieve as one. And I think maybe as I conclude, one thing which is often taken for granted, and I'm lucky that it is my name. I wish the colleague from Rwanda was still on the call, but also Dr. Ian Clark is a Ugandan, so he may know some Ugandan languages. So my name means trust. So one of the key things is nurturing trust. I think Tamian in Swahili or Ikirizi in Rwanda, if I remember properly. So one key pillar is nurturing trust. Like, we shouldn't be engaging ourselves as thugs. We need to be trusted across the entities. So having functional federations, to me, I think is a very good thing that we set as the East African region among all the countries. And it is these functional federations that can be a base of building trust between government and the private sector. Because remember, we have set the strategies together, we have undertaken landscape analysis together and developed a shared vision together, and we are operationalizing together. Now, once we have that trust within the system as a key value, I think then that would be a very good and key foundation of strengthening both within country coordination and collaboration, but also building for the region. I think as I close, usually in my part time, I become a philosopher. So the kind of logic is, once the things within the country are functional, so the deductive logic, once the premise is okay, then the conclusion should be okay. So once in country we are doing well and things are functioning well, I think at the regional level it will be very, very, very easy to achieve. And having been on the first day and seen the aspirations we set around what we want to excel on as a region in terms of achieving specialized medical care, investments in health, in innovative solutions, it is definitely very, very important that as a region we see how best to strengthen coordination and collaboration within the countries, and then across the region, so that we can complement each other based on our comparative advantages. I thank you very much, and I hand over back to you for the other panelists to continue. Thanks.
Yeah, thank you very much. You've given us some really great insights. And you have mentioned on the need to have very solid structures in order to coordinate the governance of the private and public sectors. And moving on to our the chair, East Africa Healthcare Federation, maybe what could you say are the lessons that we can take moving forward in terms of coordination of the country and regional level, the health in the country and also the regional level.
Okay, thanks. I have to admit, I'm having difficulty. I had a lot of difficulty hearing the last speaker, so I'm not quite sure, as of the points that he made. But in terms of this panel is about leadership, management, and governance. And I suppose what we've learned, what we can do better. And when I was looking at the heading of the panel, I thought, it's a good subject to discuss, because there's quite a bit of difference between all those three things. And sometimes we think if we've got governance right, we've got a board in place, We're doing the right things in terms of governance. We've got the regulations in place as far as the health sector is concerned. In fact, a lot of time the Ministry of Health will engage a lot in governance and regulation of the health sector, which is its role, in fact. And then one of the areas that's come up in discussions earlier this week has been health sector management. And, whether you're looking sometimes at the public sector or the private sector, health sector management is sometimes lacking. Not always, but the old model of where you take a doctor and you promote him to be the director of clinical services in the Ministry of Health, or you commissioner, director, that kind of thing. And it's usually a medical doctor who's never had any training in management. Or you take, as somebody, I think one of the doctors mentioned one of the other days, he's a medical doctor, and then suddenly he's put in to run a region or a district. And again, no real experience. That wasn't taught in the curriculum. And I think there is an acknowledgement that we need to, both medics and those in the health sector, administrators and so on, need to learn the science of health management. And I think that's also in our partnership here with Strathmore, because on their business school now, they now have a health management faculty and are really offering that in the region. So health management is very important, and sometimes we need to really change our thinking about it. And then we come to, and by the way, sometimes it's done very, very well, and I'm not saying doctors can't manage. I am a doctor, and I have managed, hope I've managed for a number of years to run various hospitals and institutions. But at the same time, I have to learn all the time. It's a learning curve. Then you come to leadership. And I think that's one of the big issues, both for a country, at country level and at East Africa level. What is the leadership that's been given as far as health sector is concerned? And Mary said here that COVID was quite good. It brought public and private together. You moved to attack the problems. This is leadership. And whether that leadership is given by the Minister of Health or the Director General or leadership within the private sector, it doesn't really matter. But it needs leadership. It needs direction. If you don't know where you're going, you're never going to get there. And I think focus and understanding what we need to achieve and keeping that direction is so important in terms of leadership. That's why we love Professor Kamarogo coming to talk to us, because the guy has got a clear understanding of where we need to go, whether it's in the Kenya health sector or East Africa or so many countries. He's such a broad experience. He's got a clear understanding, and moreover, he puts it so clearly that we're all going, oh yeah, that's leadership. That's leadership. And unfortunately, we've got people who can give the governance and the regulation, but can't give the leadership. And yet they're in leadership positions. They might be a Minister of Health or whatever. And one of the things I like about Kenya, again, is the fact that Kenya Healthcare Federation, do you have a round table of ministers or something, Kepsa? So you dialogue meaningfully at policy level. And another thing I like is you've got someone, IFC, the private sector essentially, who moves across to the public sector in the President's office and brings that focus and that, the perspective of the whole sector on what needs to be done. And so that's leadership. So I just think that sometimes we can't see the wood for the trees. We have many titles in the public sector, in the private sector. Sometimes we're just there focusing you in your small corner and I in mine. Sometimes we don't have the skills in management, but the big thing that we need is leadership. And that's what will take us forward. And perhaps some countries have learned from COVID. Other countries have seen the cracks. But at least maybe we will and the purpose of East Africa Healthcare Federation, Kenya Healthcare Federation, and these bodies isn't just to come and sit and talk, but to get some understanding of where we need to go, and then get the focus and then go and do it.
Thank you very much. Indeed, there is need for a lot of capacity building in terms of leadership and management in order to steer health in the correct direction. And maybe moving forward, Dr. Christine Zagini, you are a first clerk assistant sitting at the Standing Committee on Health at the Senate. Moving forward, what sort of special regulations and legislation should we be thinking as far as coordination of the next disaster, if we do have, is concerned?
Thank you so much. Can you hear me? Can you hear me? Well, thank you. That's actually a very important question. And I think we're all witness to, the varied responses by different countries and the different challenges that it brought. Because you had, differences in quarantine in one country, lockdowns in another. We all were witnesses to the challenges we had with the trackers across borders. So there's a very demonstrable need for a coordinated response across regions. But in order to answer that, then you have to take it all in context. There's what you can do at the national level, there's what you can do regionally, continentally, and even globally. At the national level, at the Senate at least, we did try to come up with some legislation, the Pandemic Response and Management Bill, that was passed in April 2020, and that was then forwarded to the National Assembly and is awaiting debate. There was also the National Disaster Management and Response Bill. It was also passed by the Senate, which basically sought to have a coordinated response within the country at national and county level. And of course, it can be tailored for the region. At the regional level, we need to leverage on already what exists. So we have the East Africa Community, we have the East Africa Legislative Assembly, and the Article 8 of the East Africa Community Treaty. The East Africa Legislative Assembly does have a mandate under certain specified areas of operation to come up with legislation that cuts across and that binds all the countries across the East Africa region. So that's health, one of the ones that's included. So that would be an important one. At the continental level, we do have a big opportunity now, and I know that the Kenya Healthcare Federation has worked very hard on this with the Africa Medicines Authority. Part of whose mandate will include, coordinating pandemic responses to health products, where you need to now deploy, medical products and medicine, whatever medicines we require in a pandemic situation. So we can leverage on that. And I think right now it's at the National Assembly, but that's something we can leverage on. And we saw the EU did. I mean, without Africa, mission actions on ensuring that member states have enough activities, coordinating the donation team, negotiating for vaccines for the whole of Africa and then deploying them across the different countries. That's something. And then at the global scale, we have the WHO with all the different offices. All of this have that together. And whatever legislation comes, whatever we already have legislation at the global level. Now it just needs to be, taken out of the regional level. And so.
Yeah, so great things happening here. That's when we can see the coordination in terms of human health. But then there's also this issue, like not getting people. There's a lot of humans and animals and plants interact. There's a lot of interconnection. And I have seen that there's a lot that is happening in terms of development, in terms of streamlining regional coordination. But here we are now, we have a bag from the animals, the name of monkey people. So this needs to coordinates human health, animal health, and also environmental health. We realize now this is not only in health, like in the human health sector. We just to tie in other things. So, if I could take it to Dr. Mohammad Shakur, who is the Vice President of the Health Federation, how would say how we are in terms of One Health?
Association almost 40% of the health services covered by the public funds. Side by side, the 400 minutes. Private now that's the government is planning to privatize hospitals, some of are starting to privatize. We were lucky so we were aware of the benefits our families, professionals were not involved in policy. That is out of 500 parameters. The first time you have 20, around 22 parliamentary and doctors with the current capacity and the different specialties. So we are advocating and policy making. As we have good policy, the policy making has been important and not easy just for the professional. So we can understand any policy concerning the health should have involved the professionals. So we are working with the government, private, and partnerships boosting this way.
Thank you very much. And I think to the Federation, how do you think that we can improve moving forward the coordination of one to improve health outcomes in both humans and animals? Yes. If I could put it up again, the question, how do you think we can improve one moving forward?
You're talking about disabilities and human health dynamics, I think, in terms of coordination. Yeah, I think Bill Gates has been quite vocal and even written a book recently, within the past couple of weeks, on the response to epidemics and what needs to happen on a global level. And I think what he outlines is really a fairly common sense approach. Basically, he says that we know that we are going to get forest fires, so we have a fire brigade. So it's kind of globally, we have fire and of course they're called into action more often. He said this is not the last epidemic that we're going to have, and so as we know there are going to be more of these outbreaks, we need to basically have a fire brigade type station set that up globally and maybe in Africa and recently. That means that you need epidemiology surveillance units, which can study your zones, and so on, which can raise the alerts when we have these outbreaks. And of course, they're relatively common. Certainly, Uganda, Congo, we have very regular Marburg or Ebola, that kind of thing. Like what polio alert polio there a few months ago in Uganda. So, I mean, the structures, some of these under CC, some of these exist regionally, country-wise, but it really needs a global system which all countries are involved in. And there's some of them that have been involved in such programs. And they do have good coordination to funding. And so the funding has to come from the country, but also local. Now, you saw in the COVID outbreak was that poor countries were back of the queue, and that was one of the reasons why, in Africa, we can't save ourselves out of it. We do here, we're either begging votes, and in many ways, maybe we were a little fortunate that COVID perhaps didn't affect it as badly as some people predicted. So, yes, I do think it's extremely important that this becomes a priority, and it'll either have to come through World Health Organization. I don't know about CDC, but and of course the government and the private sector fits into these things as well in terms of supply chains and so on and so forth. But that's the kind of response we need to have and to set up. And personally, it has been a bit best in some of the things that he has said in the past. So I think we should
We need coordinated efforts, and I think we've got from this panel. We've come to the end of our discussion on the ownership in health and how to streamline regional coordination in health through governance. We have moved the lessons that we learned, best practices, and even the challenges that we've had. We also had insights on regulations and legislations moving forward. And we've also gotten a chance to look at One Health and realize that we need to have efforts not only in the health sector, but also we put other disciplines on the way. We have and also if you have questions from our audience, and then finally we give our panelists the chance to give us their last insight. So maybe I can move on open the floor. Questions from our audience. Have a question there?
Okay, good morning. My name is Zagini. I serve the Federation at the community level, Vice Chair Health Regulation Quality and Standards. So we look at a lot of policies, regulations, and what we tend to find is that with each and every legislation, like now we are moving into the elections for Kenya. So with each and every change, there comes with a new set of leadership direction. And the challenge there comes in, especially now for the managers, the ministries, you find that there is no, let me call it a third layer that protects the institutions from these constant changes in leadership that is somehow, I don't want to say erase, but negates the good steps that we made moving along. So how do we circumvent around this as a federation, let's say maybe in the space or within this how do we influence in terms of leadership approaches? So the work comes in, finds that the institutions and the managers, the operators within the spaces got a kind of a layer that shows that we are moving towards sustainability in a commendable trajectory. Thank you.
The question is of the floor. You can have another one and then I'll ask one of our panelists to answer. Yes, another question from the floor. So the question is, we have, like in others, we have elections, but leaders and the manager left on to implement, and sometimes there's a political influence. So how do we navigate that, especially like the Kenya Healthcare Federation, who we decided in that case. So then the next question we can have from the floor. Yes, on the far end.
Good everyone, I'm Robert Mnya, Robert Research Limited. Now, the question: we have so many people outside here who may lack information regarding few things that they need to do to prevent various diseases that come maybe that they go through. For example, maybe they are they are in, they don't know that in case you do this and do this, you can be able to avoid this kind of disease. Therefore, we have several people who are full in the hospital, and some of them just need education. Is there a way this can help to ensure there are kind of forums where people can be trained on a few things that can be done to reduce the conditions that we have in the hospital? Because they say lack of knowledge make people perish. Therefore, even if such kind of information is needed to this kind of people, we believe we can be able to reduce the condition that we have. Or is there a way that can be done in various platforms? Thank you so much.
Thank you very much for the question. Do you have any questions audience? May we welcome our panelists to tackle the two questions from the audience.
One on leadership and governance and management, how to action against the changes that are expected, whether it's during elections or any other event. Institutions, as we all know, people want to make institutions strong, people that want to implement the policies and regulations that are there. I think even you have systems, and we're lucky now that we're highly digitized, even as a government. If you look at government currently, digitized 66 services. So these 66 services, whether it's a leadership change or not, these have been digitized and they are implemented by policies and regulations. Even at the digital level, there's the level, a Senate, and you have standing committees, you have standing deputies or executive orders, all like constitution, and all the decisions that are being made, there are systems and processes, there are ways in which decisions are made and recorded and exported. And so, even with leadership change, whether it's at the ministries or at parliament, you will find that there is so much ability that can come and change things, and especially when these are all aligned. We have Vision 2030 for Kenya, we have Kenya health policy that is in place. We have a budget and media place. We have all the regulators that coordinate on the functions in line with the constitution. And so these are the instruments that we have in place that allow governments, institutions, and even federations to continue. So strengthening is really helps, because even your personality that and want to do things a certain way, you may find that at some point in your leadership, you're really not making any gains because there's certain of a government of KHF, for example, private sector put KHF to task, then not ourselves in the policy because our issues being addressed whenever we raise them. What I do, so and we are really sure that the economies in South Africa and in Kenya if you look at we were 20 years ago, more engaged population, we have understanding our ability to question leadership, put leadership at task, and with the leadership and know that they're not coming in to have a clean slate. They are already with whatever is there. They need to come in and build upon what is already there and improve on it.
We also had a change leadership. So these changes, you guys.
Maybe not like whatever we already come to end. But I think need to start.
And actually also just to join what she said, also what she said, first of all, the person who's coming to already existing institutional policy, but already existing institutional policy environment. So there's only so much to do. But for the changes that they want, people that they may be able, that they may wish to push forward, usually it's coming from some industry that's not from a vacuum. So the stimulus may or not be aligned to your interest. Maybe that's what for you then constitutes a problem. But my best advice would be, because you're in such a dynamic sector that changes every day, my best advice would be, even within the changes that a new leader, within his constraints, is able to do, is adapt. And see yourself as a stakeholder, someone who actually, rather than it's happening to you, see yourself as a stakeholder who can participate in making of that decision, and try and align it as much as possible through your federation to something that you know address. So it's not necessarily buying.
Most countries, the health institutions, health systems led by most of yes. For example, in a hospital, somebody biology graduate or mathematician can be head department or head of health office that creates a problem. So, in actual fact, professionals should be assigned to the health institutions. But health professionals also have to be involved in policy making and health management and the health administration. That will solve the problem. Sure.
I think I've told you all about the first question. But another issue I think would like to share just a little bit of the issue of that reducing communication of opioid post. We have, I think we should ask ourselves, there are several things that we can do. One of them we can use, since some of got the notion of using electronic. Also can help to reduce, because the number of people will come out with their convenience drive can use the backload that facility at that time. Also, another areas might be due to laxity of those workers are not committed to their task. So we have got a special digital system that can produce the components of a facility. That's the state of the component system from the facility. What happens in the facility communicate if the system is coded within that facility. So doing needs so tremendous communication that facilities. Those kind of areas. But we can not answer that. I think we better go and try to look for cause for that facility. And if we find that the cause, then you can
devise the mechanisms for solving that problems and educate them. Also, we know the head of the directors of the hospitals and universities. They are the one managing the problems. Most of the facilities will do that. I think to share a little bit that. The comment on those question asked by promotion, really? Yeah. So,
what is the role of in information of
I think in terms of questions, so much disease accidental. I'm and so if she adopt the right habits, then we can avoid some diseases completely, and in fact probably even extend our longevity. So I'm a believer in health promotion. Don't wait until people get sick. If you can change the lifestyle of a population, you're going to do so much more for health services than if you build medical so I think I should do digital they that lives of lives rather than reading everyone's got everyone's exercising, everyone's obese, everyone's most people have society is unhealthy. I go to Dubai, I say that is, and I send drink cups of tea, and they're overweight, and they don't exercise, smoke a lot, and this is a healthy population. But I encourage I see, I live in I other people out running now, which I would have seen, so many years ago. So these things and using digital technology, it's upon us as a health sector to really ensure that these messages get on.
Just the role of leadership in health promotion and disseminating information to the community. So the current government has done a lot in strengthening community health. We have what is called the community health strategy, and this is basically about having community health workers or community health volunteers who are embedded within the community, who act as health promoters. They have certain, they have skills to diagnose and refer and treat certain conditions like childhood diarrhea at the community level. And all these are within a network of healthcare facilities, and they're supposed to work within their communities linked to the healthcare facility. In addition, so a lot of this traditionally in our country was funded by donors, was funded by NGOs. But we have, as Kenya, there's been a huge push, both globally actually. How do we make sure that community health volunteers are part and parcel of our healthcare system? Because most of them are volunteers. They get stipends from NGOs or other organizations. But we have moved a step forward, and we have started employing community health volunteers who are working at the county level. I don't have the number of it, but they are over 20,000 currently, and that's a huge win for Kenya. We've come from zero, and now we have them on the government payroll, and we hope to continue increasing this. As part of the, and as part and parcel of embedding this, we now have a community health policy that puts in place all the prevention and promotion activities that are required. And then in addition to this, we have the primary healthcare policy and strategy, and all these were actually launched this year. Why are these important? In Kenya, we have the universal healthcare coverage agenda that the current president has been rolling out, and that will continue. And this is important because we're talking about strengthening care at the primary healthcare level, Level 1 is where you have the community, where you have all these questions, where you have all this misinformation and good information available, and linking these to the primary healthcare facilities, whether it's public or private, strengthening the referral network, having a very strong hub and spoke model that works for that community. Dr. here talked about Kiambu being one of the beneficiaries of open fences, and some of you who were here yesterday heard about what Trans Nzoia is doing. How do we harness the capacity that is at our local level to ensure that there is no idle capacity? Can we complement what is available? Can we work with what is available, whether it's skills, medical skills, doctor skills, community healthcare worker skills? You will find a lot of private health sector facilities do not know that these community healthcare workers are not only for the public facilities, they're also good for the private facilities. So how are we strengthening this primary healthcare network to feed into the higher referral systems in the country? So there's been a lot of leadership at that level, at the policy level, and all this has to be disseminated all the way down to the community level, and leadership is at all levels. So at the end of the day, we all need to put our best foot and our best effort in disseminating and implementing all these policies that are in place. And of course, all this comes with a demand for funds. Where are the funds coming from? There are very many mechanisms currently in our country that are funding healthcare to ensure that primary healthcare is available to all. Thank you.
Yeah, thank you, Dr. Njeri, for reminding us about the universal health coverage, which is one of the big four agenda of the current government. And I think we've come to the end of our session. It's been an interactive session. Allow me to thank our panelists, Dr. Francis Monizy, the Registrar of Private Hospitals in Tanzania, Danny Mutembe, who is Director, Rwanda Healthcare Federation. He was here with us and he left because of other engagements. We have Dr. Njeri Gitao, Senior Director, the President's Delivery Unit, Dr. Christine Zagini, who is the First Clerk, Standing Committee on Health at the Senate, Brendan Kwesiga, who was joining us online. He's a Technical Health Financing Officer at the World Health Organization, Dr. Ian Clark, the Chair, East Africa Health Federation, and Dr. Mohammad Shakur, who is the Vice President, Ethiopia Healthcare Federation. And for you, our dear audience, because you are very engaging and interactive, and I think we have learned a lot on the role of leadership management and governance in health, and how we can best streamline regional coordination in health through governance. We have looked at we need to start from the primary health care, moving to the county, the country, and even as a regional, as a whole. And we have also looked at the role of the leadership in ensuring that we have one health. So from me here, I want to thank each one of you for creating time to attend this session, and allow me to ask that all of us applaud ourselves for taking time to be here today. So let us clap for ourselves.
So thank you so much. A better round of applause, ladies and gentlemen. So we are actually wrapping up, and during the 3 days, I've been engaging you guys to go to the booths, visit the exhibition booth, visit the online site. So at this particular point, we have a goodie, a small raffle that was done. If you had gone to the booth, you might have undergone it. So I'll call upon David Ursula, who will give us the details of how the raffle will